I would really encourage women to be having conversations with all the women around them about making sure that they're verifying the information they see somewhere that's trusted.
Mm. Well, hello and welcome back to Redefining Midlife. I'm your host, Jo Clark, and I'm so looking forward to sharing today's episode with you. Now, years ago, I came across a website that genuinely changed my life because it helped me understand what health checks I needed as a midlife woman, as well as everything I needed to know about midlife health and perimenopause. It was a great starting point for me. And it also gave me some life-changing information on migraines that I've never, ever been able to find anywhere else. Now, the website I'm talking about is Jean Hales for Women's Health. And it's actually led me to an interview right here on the podcast a few years ago with the wonderful Professor Anne McGregor, who was the expert I heard, and she is one of the world's leading migraine researchers. So when the chance came to sit down with the CEO of Jean Hales, I've jumped at it. Dr. Sarah White is my guest today, and she's the Chief Executive Officer of Jean Hales for Women's Health, which is Australia's national digital gateway for women's health information and the leading non-government organisation giving women and health professionals trusted, evidence-based health education. Now, Sarah also sits on the Victorian Women's Health Advisory Council and the Therapeutic Goods Administration Women's Health Products Working Group, which was quite a mouthful to say then. Now, Sarah's path here has been anything but predictable. Sarah started out researching breast cancer at University College in London after completing her PhD in paediatric genetics at the Murdoch Children's Research Institute. Now, from there, she became the first director of communications for the Ludwig Institute for Cancer Research in New York, and then came home to lead communications and fundraising at the Royal Women's Hospital in Melbourne, where she also had executive oversight of the hospital's research portfolio. Sarah went on to head up QUIT, which is Australia's most comprehensive tobacco control program, before she took the helm at Jean Hales. And through all of this, she's remained an active researcher herself and is currently an honorary senior research fellow at the University of Melbourne's School of Psychological Sciences. Dr. Sarah White's work has touched more women's lives than she'll probably ever know, and I'd like to welcome Sarah to the podcast.
Oh, thanks, Jo. That's a really lovely introduction.
What an incredible bio you've got. I was just reading it through, just, amazed at how talented the women that I get to talk to. So it's incredible.
It's certainly been a roundabout way of getting to where I am now.
Yes, and that's what I want to ask. That's actually the question I want to lead with, Sarah, is that you've gone from researching breast cancer in London to a PhD in paediatric genetics to running QUIT to now leading Jean Hales, and I'm sure there's lots of in-betweens as well. What's that thread that's working all of that together for you?
Well, I actually started off with a PhD in paediatric genetics, and I was working with the families of children affected by a particular disorder. And I really loved at the Murdoch that interaction with the families, with the clinicians, and the research. And I didn't realise how rare that was at the time. Often as a research scientist, you are very much on the bench and you very rarely get to the bedside or to talk to clinicians. I moved to London to work in breast cancer because it was an opportunity to travel, in my youth, and they had really fancy tools that I thought I could bring back to genetics. And while I was there, it wasn't long after the bogus study that claimed quite falsely that vaccines cause autism had emerged. And what I was reading in the scientific literature was, this absolutely cannot be right. Look at all the evidence that shows this cannot be right. But in the popular press, I was seeing parents stopping vaccination. We were starting to see children being very badly affected by these diseases that could be prevented. And also about that time, there was all this sort of kerfuffle, if you like, about genetically modified foods. And again, in the scientific literature, I'm reading about how genetically modified rice could cure blindness in parts of what we then called the third world. But in the UK press, we had Prince Charles, as he was then, coming out against Franken foods. And so there was this mix between what the literature was saying and what the public perception of science was. And I really got in my head that people can't make a decision about vaccinating their children or, supporting different crops or supporting different technologies if they really don't understand, if there's no translation point between researchers. All of us were pretty dire, and I've always talked to Blue Streak, as you might guess. these research sort of communication, which was very much in its infancy back in this time, which was early 1990s. How could we translate it so that people could understand it? And so I made a transition. I went to night school and studied public relations. That's all I never really knew about public health. Years later, I realized, oh, that's what public health is. And so I turned to science communication. I was offered a role at the Ludwig Institute in New York, which was an extraordinary experience. And that was, again, taking the work of this extraordinary, massive international institute and turning it into communications for other scientists and also the public. So that's been the narrative, trying to, I think, inform, prepare people to be able to make really well-informed, good decisions about their health and their choices.
Well, that's amazing, and I can only imagine what you'd be seeing now, and what your feelings would be now with just there's so much misinformation out there.
Yeah, I usually thought that if we had people like me in seats where we were sharing information, we'd just be able to explain it. And there are some fantastic science communicators out there doing amazing work, and yet we seem to be really kind of going backwards. There's a whole new field of research now called infodemiology, how information spreads and is absorbed and understood. And so I probably now would identify as an infodemiologist in terms of trying to understand how information is shared, how it's understood, how it's processed, how it's valued, and then how we can influence that so that we prevent those avoidable deaths, prevent those avoidable harms, and hopefully have everybody living well and happy lives for as long as possible.
Yes. And when we think about, and we'll be certainly talking about some of the different things that Jean Howes focuses on, but when you look at the misinformation in women's health in particular at the moment, we really need to be able to have a source that women can go to that's trusted, respected, well-researched, so you feel comfortable that what you're going to be reading is going to be the right thing and not just something an influencer has said on social media.
I could not have said it better myself. You are now officially our key advertiser, Jo.
So was there a moment in your career then when you thought, right, this is it. This is the work that I was meant to be doing? Was that the work that you were talking about, that extra study you did as far as communications?
I think it was actually when I got to quit. When I was at the Royal Women's Hospital, so this is now going back to 2010, I think, to 2015. That was the first time I was introduced to the concept of sex and gender as variables in medicine. Even though I'd been a researcher, even though I'd worked in health for a very long time, that was when I actually got my education that sex and gender really do make a difference in things like ICU admission, heart attack, stroke, So that doesn't seem like that long ago, 16 odd years ago. So that was when I first went, oh, hang on a minute, I'm in the women's hospital and we're not doing anything like this because we're very focused on sexual and reproductive health. Then I got to quit and thought I can put all of these things into practice, all of my research knowledge, my communication skills, the marketing, all that sort of thing can go into practice, and that was deeply satisfying. And I had actually no intention of moving from quit. And then I was contacted by, the old headhunter who said, do you know Jean Hales? Of course I know Jean Hales. That's having worked at the Women's, of course I know what Jean Hales Women's Health is. And they said, would you be interested in applying for the role of CEO there? And I just immediately went, oh, wow, that would actually bring in this incredible interest in women's health, that understanding around sex and gender that we must have everybody understand. And so it was a bit of a dream role to step into.
Fantastic. Now, just a quick pause. If you've been listening today and something is stirring, that feeling that there's more for you in this next chapter, but you're not just quite sure where to start, I've made something for exactly that moment. It's called Rediscover You. It's a supportive, self-paced guide that gently walks you through the 9 areas of your life so that you can get really clear on what you want from here. It's private, it's at your own pace, and it's just such a great starting point for designing your new chapter on your terms. You can find it in the show notes, or head straight to joeclarkcoaching.com/shop. Now back to our conversation. Well, let's talk about the Jean House story and how it all originated then. We'll go there. And also it'd be remiss of me not to mention that the fact that this is an Australian-based website. However, women from all around the world can access the information there. So it's not, we're talking basically from now on how it originated and then the parts that women can access. So just so listeners are clear that you don't have to be an Australian or live in the Southern Hemisphere in order to access the information. Okay, so Jean Hales started with one doctor, Dr. Dorothy Jean Hales, opening Australia's first menopause clinic back in 1971, which is extraordinary. Can you take us back and just have some of the origin story about Jean Hales Women's Health and how it all originated and to the point where it is today?
Well, I'll attempt. So Dr. Hales is quite remarkable by all accounts. I never had the pleasure of meeting her, unfortunately. She was a very forthright woman, very smart. She was a GP who wanted to do research on menopause. So she started working with Professor Henry Berger, who was an internationally recognised endocrinologist and internationally recognised in terms of hormone therapy. Mm-hmm. And Dr. Hales set up this first menopause clinic in Australia. It was only the second in the world after the US. And she worked with Professor Berger on the research side of things, but also this menopause clinic. And apparently there was a story in the local Melbourne newspaper not long after she started saying, I understand it almost a little patronisingly, oh, how quaint, quaint. Someone's established a clinic. And the story goes that there was a line around the block the next morning of women who were just lined up to come to this clinic. And so she did remarkable work. She did some of the first research into menopause hormone therapy, as we call it now, or hormone replacement therapy, as we used to call it. She did some of the first research in that. And her daughter, Janet Hales Michelmore, is the patron of Jean Hales, and she can vividly recall being sat around the kitchen table and conscripted into, reading graphs and making notes in notebooks to help mum out, kind of thing. So anyway, so Dr. Hales very sadly developed lung cancer and passed away in her early 50s. And her colleagues decided to establish the Jean Hales Foundation for Menopause in her honour. So we're talking Professor Susan Davis, who I know you've had on the podcast. She's, again, internationally recognised researcher. Professor Henry Berger, Dr. David Healy, Professor Peter Rogers, who's another women's health researcher, very, very well known around the world. He's still on our board. And Dr. Elizabeth Farrell, who is still our senior clinician. So she actually worked with Dr. Hales and is one of the best diagnosticians you've ever seen when it comes to complex menopause. So they started the foundation in 1992, and it's kind of amusing because there were lots of people, lots of women who were in a position to give, who donated but didn't want their names associated with the Menopause Foundation, because it was, we love Dr. Hales and what she did, but I don't know if I want to have my name associated. And then what really, we opened a clinic in that 1992 that was directly from Dr. Hales' own clinic. Dr. Farrell took on her patients. And Prime Minister's wife at the time, Mrs. Hazel Hawke, she came and opened the clinic, and it was this almost sort of slightly scandalous. And she had a big write-up in the newspaper. We've still got that newspaper write-up. And Jo, some of the things that she says back in 1992, this then PM's wife, you could write today about the stigma, the lack of knowledge, the need for awareness, the need for education. And we looked back on that anniversary, obviously, 4 years ago, and went, we still haven't shifted the dial on some of these things. Yes. So it was really quite a big deal that the PM's wife admitted that she'd gone through menopause. So that's the story of we moved from the Menopause Foundation into the Jean Hales Foundation. We cover lots of women's health issues in recognition that these are all intersectional, all of the issues, and certainly across the life course. You can't just talk about menopause in isolation of many other things. So So that's where we are today, a very strong thread, still a very strong family connection and support. Dr. Hales was an absolute trailblazer and pioneer. She truly believed that if a woman was well, her community would be well, and core to a woman being well was her knowledge.
Yeah. Oh, what a wonderful woman. Thank goodness for her.
Oh, absolutely.
And just like that great song, it's from little things, big things grow, because where it is now, and that's where I want to ask you right now, like it's grown from one clinic into Australia's national digital gateway for women's health. So it is at the forefront for women's health in Australia as a go-to place. What does that growth look like in practice, and what are you reaching now that you couldn't reach before? Like what, I'm sure because you've grown so much.
It's a big question. So we still have the clinic. We have around about 40 clinicians who are working in the clinics, a multidisciplinary team. We see around about 11,000 women a year in those clinics.
Oh, wow.
And they're private billing clinics, which we'd love to make them free and publicly available, but we can't. It's just the model doesn't work. They're not for profit. But what those clinics allow us to do is draw on the experiences of women and draw on the knowledge and expertise of these remarkable clinicians, pelvic floor physio, psychologists, endocrinologists, gynecologists, and general practitioners. We can draw on their expertise. And so we've got this really rich way of hearing from women and knowing what some of the issues are that are emerging. So one example is a couple of years ago now, one of the sexual health physicians almost, grabbed me in the corridor and said, listen, we're seeing a massive increase in sexually transmitted infections in midlife women. We have to do some health information on this. And that was just what we were seeing coming through the clinic. So that's a really rich source. The other component of our work is the health information that you've described. And so creating health information that meets women's needs. We want to make it really understandable, practical, useful, and trusted. We want to make sure that's absolutely trustworthy. So we adhere to that evidence base, but we're able to bring the clinical expertise and the women's voices into it as well. And I think that's what makes it so useful and engaging. We used to do quite a lot in health professional education, and that started back with Dr. Hales. We're doing less and less of that because it's a success story. More and more commercial operators are now delivering women's health education. So back probably even 5 years ago, it was really hard to find courses for GPs or other health professionals or education that was about menopause or endometriosis, those sorts of things. So for a long time, it was Jean Hales and a couple of professional societies. Now we've actually got these commercial groups whose business model is predicated on bringing in health professionals. And I think this is actually a massive win. So we're doing less of the health professional education and trying to do more about sharing our clinical expertise, because at the end of the day, we don't want people coming to Melbourne to go to the Jean Hales Clinic. We actually want doctors anywhere and everywhere across Australia or further to have the clinical expertise that lives in the brains of the Jean Hales clinicians and can apply it to the women where they are.
Yeah.
So they're sort of, and then we have research. So we do the National Women's Health Survey in Australia. We do qualitative research with different groups of women. And part of that is our community engagement. So we've been doing a lot of work recently with women from Punjabi, Vietnamese, Arabic, Pacifica backgrounds, and Afghani women as well, to understand what their specific needs are when it comes to health information. So it's quite a little complex beast.
Yes, yes.
But it all fits together and complements each other. And in terms of growing, back to that idea of infodemiology, what we need to do with health information is evolving so rapidly in this age of social media platforms and artificial intelligence. So we are really trying to get to the point where we're on those channels where women are, whether it's Instagram or TikTok or Facebook. We're on those channels and we're providing that information in really engaging little chunks that women can grab hold of and go, oh yeah, I can trust that. I can trust that and I can act on it.
Yes. And that's what I've noticed on the Jean Hales Instagram account. It really is, it's bite-sized bits of information that you know is quality information, but it's also relatable for all different issues for different ages and stages of women as well, which is really
Well,
helpful.
and there's a real art and science behind science communication these days.
Yes.
It's not just we're putting something up on a website anymore. That just doesn't cut it
No, it
anymore.
doesn't.
We actually have to be employing a science around how we reach people, and that's a huge amount of time and effort and energy.
Oh, I can well imagine that it would be. So the actual website itself, because we've been talking about the website, and I will spell it out for people just in case they're not quite sure, as well as having the link in the show notes. So there'll be all of the links that we're talking about today in the show notes. So when you go on to www.jeanhales.org.au, so I'll spell Jean Hales for you, Gean.
JEA.
Oh, J, oh, jeez. Yeah, let me spell. I'll just get my letters mixed.
Start that again, Joe.
Bad thing was I used to be a primary school teacher, so imagine
Oh no.
that. Let me start again. Jean, and Hales is HAILES.org.au. My apologies for that.
No,
So the
well done.
website is structured around life stages, girls and teens, young women, midlife and menopause, and healthy aging. Why was it important that you built the website to have those different life stages rather than just by topic?
Because people have different experiences of some of these conditions at different ages. So if you think about the issues around endometriosis, for example, might start at a younger age. A young girl, a young woman coming in doesn't necessarily know that she has endometriosis. So we're trying to find different ways to bring people in to find the thing that I guess they're interested in, whether they know they've got that diagnosis or not, and then help them shift through a journey right through the life course, because we know that it's just you suffer from endometriosis isn't the sum total of your life. You're also thinking about fertility, you're thinking about nutrition, you're thinking about periods and pain, and one day you'll get to menopause. Our health is a life course, and so we're trying to reflect that in the way we set out the information.
Yeah.
I wish sometimes we'd kept it simple, but people seek information in different ways, and if we can grab a young woman really early and help her, steer her through some great information as she ages, that's our dream.
Yes. Well, it is a whole of life. I mean, we look at our health, it's important. And it's also that holistic base. So you're not just looking at one body part, we're looking at everything that's involved, which is so important.
Yeah, absolutely.
And so what sort of information is there? Because I do have a lot of my listeners will have younger, daughters or somebody that they know that they might work with. What sort of information is there for younger women and girls?
Well, there's quite a bit around periods, because we did start sexual and reproductive health. We're trying to move broader than that to reflect that women's health is more than just what's behind your bikini line, as we like to say. So we're running at the moment a campaign called Talking Periods, which came out of research we did with women or young girls 15 through to 24 who told us they still went to their mums when they were looking for information on periods and also contraception. And when we explored this a little bit more, what we found was that young girls would go to their mums before they went online, before they went to their friends. So we looked across everything that was available in terms of health information, because we never want to repeat or reproduce something. We don't want to reinvent the wheel. We looked across and said, there's lots of information for girls about periods, but there's nothing for parents about talking to their periods. And we wanted to make it for parents because we believe dads should be involved in these conversations.
Yeah, absolutely.
And some families only have dads, right? So or some households have dads and some have mums. So we've developed this Talking Periods campaign that is purely resources for how do you have the discussion with First Nations girls, with multicultural communities, and so a whole heap of resources. And I can't remember what the latest numbers are, but we've reached tens of thousands of people online with this information about actually how to comfortably start the conversation and just have a talk about it. So there's definitely information there for periods. There's information for period pain, because we know that's a big issue for young women. And then, pretty much everything else right through to menopause can fit women at any age. Menopause, obviously, more for midlife. We do cover early and premature menopause as well. So, yeah, there is there's things we still want to build out a bit. We're doing a lot in the healthy aging space. We
Mhm.
still have more to do with the younger women as well.
Yep, yep. And so that's what I encourage anyone when you go onto the website, have a look around because there is so much information there, and that will also take you on to other things that you can look at as well. So it's quite amazing. But for women in midlife specifically, because this podcast is for midlife women, what would you want someone landing on the site for the first time to find?
Um, well, I hope they're going to find something that's useful for them and why they're there. So yes, we have the straight health information, but we also include lived experience stories because women have told us that being able to read about someone else's experience is really comforting, reassuring. So many women have reached out to say, I don't feel quite as alone when I see that other people have had something similar. So we have lived experience stories there as well. We have menopause information in different languages. We have menopause information that's in an easy read format. So for someone who might have a cognitive impairment or helping someone with a cognitive impairment, we have that. We also have tools like the menopause symptom checklist that you can print and take to your doctor and say, these are the things that are bothering me. So I would like to have someone come to the website and say, wow, there's so much here. And oh, that's what I need. I want everyone to be able to say, that's what I need when they come there.
Yes. Well, that's great. And I think if when you go on there too, listeners, you'll notice that it's set out that way. It is very user friendly. And if we talk about healthy aging, and that's really important because all of us, God willing, we're going to get older, but
Yep.
that has its own space too. So what changes about a woman's health needs as she moves past menopause into her 60s, 70s, and beyond?
Well, we know about looking after ourselves. And I think we're actually thinking about changing the term healthy aging because women tell us that doesn't really resonate with them. So we're thinking about how we do that because we start aging from the moment we're born.
Correct. Yeah.
And we do have to think about our future health actually well and truly into our 20s to get through to a really healthy 70s. But let's think about midlife women. We need to think about our brains, keeping them active. We need to think about keeping our muscles active, the weight bearing exercise for our bones. We have to think about that. So the things that change from menopause on are probably all the things you've covered on the podcast already, Jo, about the, bone health, muscle health, all those sorts of things. But we're looking at a few issues that maybe people aren't thinking about that aren't traditionally the menopause. Things like making sure that you're on top of your hearing loss. So if you start to experience hearing loss, you go and get it addressed. If you start to experience some vision issues, you go and get them addressed. You keep socially connected. That's really important. You choose foods that are right for you, and those nutrient needs change as you get older. And the reason we're putting so much emphasis on some of these things like social connection and hearing and vision is because these are modifiable risk factors for dementia. And so we know that the work you do in midlife, we all have to do in midlife, actually sets us up really well for when we hit our 60s, 70s and beyond, because actually dementia is the leading killer of Australian women. And we can do something about it in about 45% of the cases. So those things about aging well are not necessarily about just doing your weights. It's actually about looking after your whole body and your brain.
That's an empowering message for women to take home as well, that you can do something about it and
Absolutely.
to do it earlier rather than later as well.
Absolutely. And we did our National Women's Health Survey last year. We looked at dementia prevention knowledge. And in fact, very few women know that there are these modifiable risk factors. So I'll encourage everyone to get on and have a look at that. Yeah. There are some simple things that we can do to reduce our risk. And I see it as a massive opportunity. We can do a little bit to increase knowledge, and that will have a big impact at the population level.
Yeah, brilliant. So let's talk about health checks now. I've actually got an online wellness membership for women, and I support them to create their own personalised wellness plan. So everyone is going to look different. But what's really important is the resource that we can use from Jean Hales is that the health checks. So when we have our initial annual planning process, we use that checklist. So women can write down in advance, all right, I need to book this, this, and this. So for all of you listeners, there's a whole section that's dedicated to health checks for your age. And now there's even a free online tool called Her Health Check. So tell me why that you built that for at Jean's House, and then what gap was that filling?
Well, there was a big gap showing up in that people knew they had to go and have health checks, and some of them they knew pretty well. So I know I've got to go and have mammograms for my breast screen. But what we heard was, I'm just not sure when and how often and what I might be due for now. So we were trying to really reduce a bit of that barrier to entry. And so we developed Her Health Check, which you simply go on and you put in your age, whether you're pregnant, breastfeeding, and smoking, because that changes some things around lung cancer screening. And it comes back with a little list of the things of the checks that you should be doing, and directs you to other places for more information. We're well north of 30,000 completions of that health check tool. We also developed a tool for First Nations people, so Aboriginal and Torres Strait Islanders, and that's because they have different thresholds for some of these screening checks. We wanted to make sure it was really culturally appropriate, the language that we used. And I think we've just passed 1,000 First Nations women doing health checks, which, is a really good result, because often First Nations people feel disengaged and don't do these sorts of tools. But we work really closely with community-controlled organisations to share this. And, if we can just get out of all of that number 0.001% who are going to go and do their bowel screen or their breast screen or their kidney check, that'd be a great thing. So it's just designed to reduce some of that friction and that, I know I'm due for something, but I don't know what it is. Well, actually, let us help you.
Yes.
Tell you straight away what it is you're due for.
Brilliant. And that's easily found on the website as well. So you go on there, it's easy to find.
That may be for the international viewers. That won't be the same checks in different countries, but you could still go and look at it, fill it in, and then you've got a sense you can match up to what ages and where you go in your country.
Yeah, brilliant. Another thing that Jean House works around and runs is Women's Health Week in September each year. And that's become a genuine national movement. And it's amazing to see you on the socials, the amount of information that comes through during that week. How did that start, and why do you think it's grown in the way that it has?
Started back in 2012, and it really started because, as you know, women's health has often been not really discussed in polite company, and so we didn't talk about it, or maybe we talked about it with our mums in whispers or our girlfriends in whispers. And the organisation back then really wanted to draw attention to the fact that women's health is not something that should be just whispered about, that we should actually be talking about it and sharing information and sharing experiences. So it's grown extraordinarily. I think we had something like 9 million people engaged in our socials for last year's campaign. And it was Say Yes to You was the theme. And it was really about encouraging women to prioritise themselves. That's when we launched Her Health Check. Say yes to doing your checks, say yes to taking the time to go and do your screening, go and, do whatever you need to do. And the theme has really resonated with women, and we have people now each year going, what's the theme this year? What's the theme this year? So this year it's going to be do it anyway. And it's really about getting some tips from ordinary everyday Australian women saying, well, how do you do these 5 pillars of health? If we look at nutrition, physical activity, social connection, mental health, and sleep and rest, how do you do it? Because you can do it anyway. Forget the barriers, go and do it. Or you can do it any way. Start with a walk around the block. You don't have to be going to the gymnasium, in your Lululemon outfit. You can actually start just walking around the block, or you can start by doing some squats at the kitchen bench. How are you going to do these little steps that will make a change and make a difference? So it has grown. We're thrilled that we've got the support from the Assistant Minister for Women, for example, who's really amplified those campaign messages here in Australia. And we're looking forward to an even bigger campaign this September as well.
Oh, fantastic. Looking forward to seeing that. That'll be good to hear and see.
Yeah.
The next section I want to talk about is the area that you've got on the website now is called Learn About Pain, because there are so many women who experience chronic pain, and there's not a lot of information that they can find. So it's just looking at how our thoughts can actually influence how much pain we feel. That's a real different way of talking about pain than most of us grew up with. Can you just help unpack a little bit of that for us?
Yeah, look, pain is such I don't want to say it's a constant for women, but it's an ever present issue for a lot of women. And that can go from really mild period pain through to chronic pain, as you discuss. We're learning more and more about pain all the time, and it's women's pain is actually far different from men's pain. We have different pain receptors. We process pain differently at a physiological level. It's not just I might describe it differently. We want to do a lot more in the pain space because I think it's an area that's really ripe for the Jean Hale's touch, which is creating those really practical, useful pieces of information. And when it comes to it's there's such a discussion at the moment about women feeling like their pain has been ignored and dismissed, and unquestionably that happens. Unquestionably, there are women whose pain experiences are dismissed and ignored. But our challenge is how we talk about pain in a way that doesn't erode trust between a woman and her practitioner, because I think we're starting to see that. So in some ways, we're trying to bring in a bit of nuance there to talk about how can women describe their pain, but also how can women understand their pain. And it's been very well known in sort of pain studies that your mental attitude to pain and your mental, I hate to use the word resilience, but those sort of emotional and mental reserves around pain can really influence how you experience it. And so we're trying to find a way to really talk about how we set ourselves up to think about pain and experience pain in a way that doesn't dismiss it, but actually helps a woman manage it. And I feel like I've just rambled and raved there, Jo.
Not at all.
It,
It's fascinating because it touches so many people's lives, and it's something
it
that,
really does.
really people are
Yes.
wanting to have more information about.
Yeah, and I think that sometimes we try to we're going to fix this physical pain. We're going to go and get the pain relievers. We're going to go and see the physiotherapist. We're going to go and see the neurologist. But actually, we also need to find ways to shore up that emotional resilience and that mental resilience as well, because actually psychologists can really help too with managing pain. Because sometimes with chronic pain, it's about acceptance that this is a pain and how do I now manage it and live with it.
Yeah, yeah, makes sense. We'll look forward to that being rolled out too in the near future.
Oh, well, a simple thing, I tell you, one of the things I'm sort of thinking about is, when you get that question, what's your pain like on a score of 1 to 10?
Yes.
What the heck does that mean? My 5 could be
Yeah,
your 2,
that's exactly right. What
right?
the hell does that mean? That's such a good point.
It means nothing. So
Yeah,
we
yeah,
really want to try and do things like, okay, let's say a 4 is actually I take some painkiller and it doesn't happen,
yeah.
or 10 is I can't get out of bed, or 7's so simple practical things that allow a woman to have a really good conversation with her health practitioner, I think is something we also need. So stay tuned on that one.
Yeah, that sounds good. I'll look forward to that because it is, like you've said, it's very relative. Everyone's
Mm,
different to what they feel. The next part I wanted to talk about is on the theme of talking to your doctor because that can, women
perfect.
do have. We just spoke about pain and how that can be different, and the discussions are different. You've built an entire resource around how to talk to your doctor. Why is this kind of self-advocacy really important for women specifically?
Well, because we do have a gendered response to women's pain, for example, and we do have, I don't like using the term medical misogyny, but there certainly has been historically a traditionally male GP workforce, for example,
Hmm.
and they've been slightly dismissive of women's experiences. I think that has definitely changed, but we do sometimes have to really advocate for ourselves and advocate it for attention, particularly given GP appointments, because that's usually what we're talking about. GP appointments are quite short,
Mm.
and we need to get the most out of those appointments in a way that's productive. So a lot of women still lack the confidence to really have hard discussions with doctors. They've traditionally been seen as this, quite authoritarian figure, which again might not be right, but that's sometimes how we feel in those consults. So we wanted to develop a resource that allows women to go in a way that they're prepared, they have their key issues, that they can have a productive conversation, and then handle, have strategies for if they feel like they're not actually getting through to the doctor. And I don't want to put it all on a doctor either, because I do think that some of the challenges we have is a mismatch of communications rather than a doctor dismissing the woman's experience. Definitely some do. I'm not saying they don't. But I do think that doctors are diagnosticians. And so if you go in with a sore foot, they immediately in their head are doing mental calculations of, well, it's not cancer of the toe and it's not broken and it's not. And they go from worst case scenario through to this is probably what it is. But when they then say, oh, look, don't worry about it, it's nothing to worry about, in their head, they're dismissing cancer. In the patient's head, they're going, well, they're not listening to me because I said, don't worry about it.
Yeah.
So I think we have a mismatch sometimes of communication within consults. So if we can prepare women and prepare health professionals to have a really good interaction, we're going to have better results for women.
Yeah. What a great starting point for somebody to go into their doctor to know that they've got, all right, I've got something that can really help me through. You're feeling far more less anxious, far more empowered, and that way that you can not waste time, get straight to it.
Absolutely. And the
then,
confidence.
Yes.
The confidence is important.
Yeah, it really is. Because some of these topics that you talk about, it is uncomfortable, especially if it's not to another female. If your doctor is a male, for many women, and particularly from different cultures, it could be very, very difficult to have these open and honest conversations.
We have a menopause symptom checklist, and a few months ago now, there was a lady told me that she went to her doctor to talk about menopause, and the doctor said, this is in a country area. There was only one doctor. I think you're fine. Don't worry about it. If you've still got issues, but I think you're fine. Don't worry about it. So she went to the symptom checklist, printed it out, ticked it all off, took it back to the doctor, put it down on the table, and she mimed that, put it down on the table. Right. Now let's say whether there's okay. All right. Yep. Okay. Right.
Yes.
From the doctor. So those simple tools.
Because she's taken more seriously then, not being
absolutely. Well, if you have something that you can show or demonstrate or speak to the impact something that's having, and that's the top tip I tell everybody. If you go in and say, oh, my elbow's really sore, it's like, oh, okay, right. But if you can say, my elbow is so sore, I can't do this or I can't do that, it immediately helps focus the conversation. So that's, just simple tips like that can really make a difference.
Fantastic. And again, we're talking about a simple tip like how to speak to your doctor about something. Also, that's on the site is just so much available in a huge range of languages. And I think I counted over 20, and that includes specific information, as we mentioned earlier, for First Nations women. Why was that such a priority for Jean Hales?
Well, Australian has, I don't think we can even count how many languages we have. We're a very multicultural community, and these women absolutely need and deserve health information as well. So it's been a priority. It's all women. It's for all women, not just women who have health literacy. And, one criticism I've had for the website is, someone say, oh, but the information's very simple. Yep. Deliberately so, because health literacy is low and we want you to have the concepts that you need to make decisions. And if you want to dive into the, cycle of the follicular luteinizing hormone or blah, 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 that's fine. But you've got the basics that you can then use to go somewhere else and dive into it. We want the woman who has English as a second or third language to be able to come to the website and understand it and take away what she needs, or the young woman who's not health literate, or just the regular woman whose head is full of, crops and tractor repairs or whatever, to be able to come and go, right, I've got what I need. Yeah. So having different languages, having easy read information for people who don't read English, so pictures and very, very simple text, it has been an absolute priority. And we're working on audio versions as well, so that if you don't read at all or you have vision impairment, you can still get the information you need.
Oh, that's fabulous. It must mean such a difference in the confidence of a woman who may not have English as their first language to find something, or somebody who may have a learning disability to find something that they can access easily.
Absolutely. And we're really privileged to work with people like Women with Disabilities Australia, for example, with a variety of community groups around Australia to hear directly from women, because sometimes the cultural context, particularly if we're talking about things like periods and menopause or contraception, there's a very distinct cultural context around the information as well. And so we're really privileged to work with a lot of women at that grassroots level so that we can make information that's not just medically accurate and written in simple language, but actually fits the cultural and social context as well.
Yes.
Yes.
How does Jean Howes, this is just for my own interest's sake too,
Sure.
how does Jean Howes raise money or access monies to be able to do all of these things? Because there's a lot that it does. Like, is there government grants that help, or is it
we're very fortunate. We're very fortunate to have a large grant from the Australian government. We've been fortunate to have that for 5 years, and we've just had it renewed for another 2 years. So we are, as I said, incredibly fortunate to have a government that realises women's health information is critical and that it needs to be provided as a public good. And then we do have some major donors who give us money, and we go to trusts and foundations if we have a particular program that we want to do. Maybe it's a targeted information for a particular group. We can go and say, listen, this is this amount of money. So the healthy aging materials, for example, that was provided by a gift from the Alan and Kate Gibson Foundation, who gave us 3 years of funding to develop that healthy aging hub, and which has been remarkable. So we're very fortunate. Some of the work we're doing now, we have a partnership with Priceline Pharmacy. They have a real commitment to health as well. And so we're doing training, for example, for their pharmacists so they can provide really great evidence-based information within pharmacies because they're so accessible, of course. That's a great way of getting the information out. So a variety of ways. We don't do tin rattling, but we do get some donations through our website, and we're always very grateful for the support because we run a very lean machine. And we are able to put a huge amount of every dollar that's donated goes into the mission delivery.
Well, really, when you think about it, you're doing the government a favour, because this is a one-stop shop for women to go to. It's got so much there. That's something they don't
exactly
have to
right.
do.
And governments are they scrutinise the dollars they give out, for sure. And we have a very strict work program and evaluation, and we're operating to requirements. And to give them credit, Department of Health are really very hot to trot on making sure we are covering the multicultural communities as well.
Yes.
So it's very efficient for the government to have somewhere where women can go to a place that's free of agendas, free of vested interests. We're not selling anything. It's evidence-based. It's practical. Hopefully we're certainly saving them money, if not right now, then down the track as women stay well.
Yes. Yeah. Brilliant. Well, I'm hoping that the discussion we're having today is really going to help women who didn't even know this site exists to be able to dive in and get some of that information. So if you could just get every woman to do just one thing after hearing this conversation, what would it be?
Oh, Jo. Well, it's going to sound self-serving, but I think it is finding and going to really credible sources of information. So misinformation, disinformation, and now what we're seeing, this malinformation, is just rife on social media, rife. And we are seeing people turning away from cancer treatments. We're seeing people turn away from vaccines, women now starting to refuse vitamin K shots in the birth suite. This is a public health disaster coming down the track. And that's the extreme. But in the middle, there are a lot of women who are really desperate for answers, and so are seeing supplements on Facebook, for example, and saying, "Oh, they're saying this will fix my hot flushes," and so I'll buy those pills for $99, and it makes them put off going to see a doctor. It has them wasting money. It has them having things that don't go through the same sort of quality controls that medicines do. So I would really encourage women to find those really great sources of health information. It could be the Australasian Menopause Society, it could be Jean Hales, it could be any one of these non-governmental organisations or the government websites. And whatever you see online, check back with one of these trusted sources of information, because it's really easy to get information on TikTok, for example. But, there was an analysis done of TikTok health content about 3 or 4 months ago, and I think it was 45% of health information on TikTok was completely false.
Oh, wow.
And that's where most young Australian women are going for health information right now.
Yeah.
So I would really encourage women to be having conversations with all the women around them about making sure that they're verifying the information they see somewhere that's trusted.
That's great advice. And yes, and hopefully all listeners will know that. And if not, they do now. You can't unhear that. You can't unhear it anymore. So and as we wrap up now, what's next for Jean Hales, and what are you building towards? You talked about the pain section you'd like to work on. What other sorts of things would you love to be able to branch into?
I think we really want to look at some of these intersections between issues. What happens specifically as if you have endometriosis and you go through menopause, what specifically happens for you? I think there's a bit to do there. Pain. But I think there's also lots of silent issues for women's health. So people who suffer from fibromyalgia, for example, migraine, as you know, we sort of covered that. And we're also trying to really prod, poke, shame single disease organisations that don't look at women specifically. We want them all to be looking at women specifically. So partnering with other groups to say, look, it's great that you cover whatever, dementia. How about dementia specifically for women?
Yeah.
Because it's not just women as carers, different disease course, sex matters, gender matters.
Yes.
We'll be a gateway for you to your information, but it has to be women specific. So I think that partnering, advocacy, as I said, prodding and shaming these groups into making sure they have women's health information is certainly something I'm keen to do. And then I think the other thing that I'd really like to do is to make sure that we are doing even more to reach women in these social media channels. So we can't possibly, back to the dollars, we can't possibly make all the content that we need to make to be on those channels in sufficient frequency to get cut through against the influencers and the wellness companies and the supplement groups. We can't do that. Sadly, the government won't hand over, $20 million for us to do that. So what we want to do is actually amplify those educators that are already doing really great space in the stuff. So I'd love to see. So a great example of this is a few months ago, there was an doctor influencer in the US who said, your brain is eating itself during menopause if you don't have hormone therapy. And it was based on a single rat study that showed increased metabolism. So we have in Australia a fantastic neurologist, Dr. Sarah Mackay, a neuroscientist, Dr. Sarah Mackay.
Yeah, she's been on the podcast.
Yes, I don't know. And we also had Professor Pauline Mackey, who's in the US, one of the top 2 researchers on brain and menopause. And Pauline took to social media for the first time to explain why you didn't need to worry. She explained all the science so beautifully. We amplified that out to our channels because we thought it was such an important message to get out there, all these women who are maybe worried about this message. And I think probably to date, the quietly proudest moment I've had is, one of the big mainstream media news channels took on this, your brain is eating itself. They did have buried in the middle of the story, experts say this isn't really true. But on the Facebook page underneath that, where there was hundreds of comments, there was one person who'd written, the Jean Hales specialists say this isn't true. And several people had gone, yep, got it. I'd like to have these, if a crazy claim comes up on social media, women can look at it and instead of going, oh my God, they can say, oh, let me see what Jean Hales says about that.
Yeah.
And to be able to go somewhere and have us going, don't worry about, here's Professor Mackey, who's the world expert. We say you can trust her, listen to her. She's the expert. Yes. So that's what I'd really love to be moving towards now, taking the great work being done by so many people, many of whom you've had on the podcast, and making sure that women who follow us get to see the very best of them as well.
Brilliant. Well, if you're not already doing it, I'm saying you're doing it now, but if it can even be amplified more, that's something to aim for. Yeah.
That's the dream.
Yes.
That's the dream.
So just on a personal note now, Sarah, what's one thing that you're enjoying about midlife and one thing that you're looking forward to?
At midlife, I tell you, I think it's really hard to explain, but there's this sense of I really don't care as much about simple or small things that I used to. There's a freedom, and I don't quite know how to explain it, but we sort of have a running joke around how could we explain the DGAF syndrome that women get at menopause. Because there really is. I'm enjoying wearing white pants again, Jo, without a worry. Traveling without having to worry about, products, all this stuff. There is a freedom that comes at midlife. And I think it's that Sarah Mackay probably talked about, your brain evolving yet again so that you have this consolidated wisdom. You're confident. You're confident in your skin. You've been around the sun many times. You're really not worried about all the little things. And I love that. I really love it. I wish I had this feeling back in my 20s, 30s, even 40s.
Yes.
So I love that. What am I looking forward to at a personal level, professional level?
I'd say personal, but you can do both, either or.
Personal level, I think launching a teenager out of the house, that would be great. But yeah, look, I think it's just concentrating more on me. I think that becomes more important as you get older. I need to find that work-life balance where I concentrate more on me. And yeah, sounds very self-centered. See, aren't we silly? We sit here and go, oh, it's really self-centered to worry about me. But actually, that's what we should be doing.
That's exactly right. That's our
strange not to,
isn't it? Yes.
It's strange not to.
And just finally, what do you think that 80-year-old, or hope that 80-year-old Sarah will say about current day Sarah?
Oh, you did well. You changed things. You actually helped some people, no matter how few. I think 80-year-old Sarah, I hope, get there, touch wood, will actually look back and go, yeah, actually, you made a difference.
That's lovely. Well, you have, and you are, and I'm sure she'll be able to add so much more to that. So thank you so much for all the work that you do. Thank you for your time today. And if you haven't already got the hint, go to Jean House for Women's Health. Oh my God, I'll get my letters in my mouth or the words right. jeanhouseforwomenshealth.org.au, and that is Jean with a J.
Thank you so much, Jo. Really appreciate your support and your kind words.
Absolute pleasure. Thank you. Thanks so much for listening. If you enjoyed today's episode, please rate, follow, and share it with another incredible midlife woman. And join me next week as we keep creating an amazing second half of life.